With Ariana, our lovely patient. She is having her first SculpSure procedure right now. How are you feeling?
I feel good. It feels less of coolness and then less of warmth.
Awesome. And we've just started. We're at an energy level of 1.3. I'm going to show you what that looks like. And she is doing really well. We're just kind of waiting right now. We've got 20 minutes to wait, a 4-minute period in the beginning with the build up. How did that feel for you in the beginning?
The beginning felt like it was just ice packs, which is very cool. Like numbing kind of.
Okay, and so you work out and you help, do you eat healthy?
Yeah, I work out. I try to eat healthy as much as I can.
Yeah.
So I'm just hoping this will get rid of like the little stubborn area of fat that I have.
Yeah, and so usually, typically, these are the best types of candidates, you know, ones that maintain a healthy lifestyle. You know, Ariana is working out. She's already thin to begin with. That does not mean that you can't use a little bit of extra help in stubborn areas. So, yeah, so we'll see what's going on. So you're going to be with us for a little bit. So these little arms here connect to the device, and these are the applicators. So I'm going to get really close so you can see. Each applicator hooks into a frame right there. And I provided ice packs for Ariana to use in case she needs it. She's feeling good right now.
Yeah, I don't need them yet. Hopefully I don't need them.
I think it'll be completely fine. So we have a fan here to keep Ariana cool. I've set the light, and just so we'll go through because we have some time here. We already took pictures right here. So right here is where we took the before pictures. There's a guide that helps us kind of take pictures consistently every single time so we can mark the progress of the patients. And we have a very relaxing setup here. So I already went through all the instructions with Ariana. You know, I spoke to her about being hydrated and eating before the SculpSure treatment. It's very important. And what we're going to do is we're actually going to follow her progress. I'm going to follow up with her tomorrow and see how she's feeling. But yeah, it's not invasive, so it's comfortable.
It's very comfortable.
So sometimes this happens with the applicators. It's not to worry. The sound is completely normal. And I'm actually going to have Ariana, do you mind just holding these two? Perfect. So patient participation is always helpful. Everybody's anatomy is different, so everybody has a different shape to their tummy and to other areas that we treat. And so the machine, as a safety mechanism, just lets us know that we've lost a little bit of contact and to reconnect.
So what are the other areas you can treat?
So yeah, the great question. So we can treat the lower abdomen, upper abdomen most commonly, bra fat, the flanks. Most men have issues with their lower back flanks, and most women. So we treat men's pecs. We treat the inner arms, the outer arms, inner thighs, back of thighs, outer thighs. So there's really, if you can pinch an inch on that area, there's really nowhere we can't treat except over little divots like the belly button, and on bone it's a little bit more sensitive.
What about how many treatments do you think I would need?
You know what, like I always recommend 2 as a minimum because that's the protocol. And really it's about a maintenance plan. So 2 treatments minimum in one area, and then I always, you know, I want you to get the best results. So I think 3 would do really well in this stomach area. I think it'd be really great with 3.
And I can go back to regular activities right after?
Yes. So we actually encourage patients always to work out, sweat, and go do a spin class tonight. I mean, it's so important to get your body moving and to sweat those fat cells out. Because once they're dead and they're eliminated, you know, they've got to go somewhere. So once you sweat, you're gonna eliminate those. So I want you go to a steam room, get a lymphatic massage that area. That is your excuse to go.
I have a good excuse.
Totally, and I mean seriously, you can go 10 minutes after the treatment. You can go to the gym, which is incredible.
No downtime.
Absolutely no downtime at all. Some patients experience a little bit of redness, possibly in the area, some light bruising, maybe. Some swelling, but that's all completely common, that's normal. And you know, I always recommend after to massage the area deeply so we can break those fat cells up. And so that'll eliminate any chance of getting like little bumps under the skin. Sometimes you hear with patients that get other procedures that they have bumps. And those are that means you had a great treatment. It just means that the fat cells died and they need to go somewhere. Yeah. So how are you feeling right now? We're about 7 minutes in.
I say we turn it up if we can.
Ooh, getting risky. Let's do it. All right, so here we are at the screen here. Okay, so I like to count down. Some practitioners count up, so she's 7 minutes, but I always do the countdown method. I find that it works the best for me. And I'm just gonna pump up the energy a bit more, so we're at 1.4. How you feeling?
Good. I don't feel anything.
Oh, amazing, amazing. So right here, if you notice, there's a button right there for a cool blast. So Ariana, I don't think I explained the cool blast to you. So at any point, if you feel that the machine is it's getting too warm, maybe it's not tolerable, I can provide a cool blast where all 4 of the applicators cool you down in that treated area. Very relieving for patients. They feel like their whole body gets cool. It's a laser, it gets hot, you know, and you sweat. So it's just a really refreshing feeling, which is what I found anyway when I did mine. But it adds just a minute extra to the treatment. So totally fine, I'm here at your disposal. So you do it. I want you to be comfortable, so just let me know if you need a cool blast at any point.
Yeah, it's very comfortable. It's just, now I feel a little hot, but it's nothing intolerable for me.
Good. And have you, so you said you're 22?
Yeah.
All right, so 22 years old, man, I wish I was 22 again. But when I was younger, I definitely, you know, a lot of patients think that when you're young, you don't need to start these treatments. And it's actually the opposite. You want to start when you're young, so that it's more of like a maintenance. A preventative, yeah, it's a preventative measure. So if just think about it, you're already eating right, and you're already maintaining a healthy lifestyle. So this is going to permanently eliminate the fat cells in the area that we're treating here. Those fat cells are destroyed. They're not in your system anymore, and the fat cells around can grow. So that's why it's good that you're maintaining a healthy lifestyle. So you're 22, and this is amazing. You're doing it now. Most people, you know, you're never too young, and people always say too, you're never too old. We have a wide variety of age ranges here, of patients that get SculpSure and other procedures. So everyone is welcome. So let's see. We've got 11 more minutes.
Okay.
Still feeling good?
Yeah, I feel great.
So, have you ever had any other cosmetic or non-invasive procedures before?
I've done laser hair removal on my armpits.
Okay.
And that was much more painful than this.
Really?
Yeah.
If you could describe the pain, just for the viewers, like so some patients may have gotten laser hair removal that are watching. So how can you describe it? Like, what are the differences and what are the similarities in the pains?
The laser hair removal kind of feels like rubber bands snapping at your skin, and the armpits are a very sensitive area. So that was probably like, on a scale from 1 to 10, with 10 being most painful, like an 8 for me, but everyone's different. This, I don't feel any pain, just feel coolness and a little bit of warmth.
Which is awesome.
Yeah, so this is great.
So you basically, they're both tolerable pains. It's just a different type of feeling. It's like a snapping versus a cooling and warm feeling. That's great to know. I mean, a lot of, there's other devices on the market that do, eliminate fat cells. So, and I think you've known, you know a couple of them. And you had mentioned that you had gotten or were interested in doing a different fat elimination procedure.
Yes.
I can personally speak for myself. I used a different device. I had fat elimination, and it was a different type of feeling than the SculpSure. So my experience was, I had a procedure done that was a cooling procedure to cool the area and eliminate the fat cells that way. It actually had wonderful results, wonderful reviews for other patients. From my experience, I only had the one because it kind of left like a stick of butter feeling on my stomach. Yeah, and it was like weird to me because I was trying to massage this area, and I'm like, oh my god, nobody wants to feel their skin like that, So I was hesitant to try SculpSure. I was nervous when I first saw the machine, and then when I did a little more research on it and I realized that it was a heating rather than cooling, I thought to myself, like, that can't be bad. We use heating pads for our stomach, like,
right.
Probably soothing. And it was just that, like, there was no downtime for me. There was no massaging needed to break up like a huge stick of butter. It was more like, let me massage my area, treated just like a soothing massage.
And this is quicker too, right? It doesn't take as long?
Yeah, no, it's...
The other treatment?
Yeah, the other treatment took a little bit longer. This is amazing. It's like a half hour, you're done. And I was able to wear a shirt without having it stick out looking like I had a baby in my stomach. So that was helpful.
Yeah.
But it's all about patient preference, of course. And I can definitely say personally from my experience, though, SculpSure won my vote. Yeah, and right now, I am due for my second treatment. I did it around 6 weeks ago. And by 12 weeks, optimally, you see the results. Assuming you've had 2 treatments 6 weeks apart. So I'm due for my second treatment, and I'm actually looking forward to it. It was like I could more so relax and take a half-hour nap. But it's sensitive for some people and it's not for others. So I'm happy that you're feeling good.
Yeah, I feel great.
All right, so I'm gonna go over here. Just gonna focus on this so I can show everybody here. So as you see, we're 13 minutes in, 7 minutes left to go, almost, not even, almost 6. And we're at 1.4 this whole time. So that's incredible. You've been great. So almost done. So what I would recommend is coming back in about 4 to 6 weeks. We'll do your after photos and we'll do a second treatment in the same area. And then we can, this is great too for the love handles, upper abdomen. So, Ariana, I think you have, we had spoken about a plan that we're going to put you on for full body SculpSure treatments.
Yes. Can't wait.
Yeah, it's good to start now because a lot of people feel like they hibernate in the winter, right, so they can put on those extra pounds.
This will kind of prevent you from gaining those extra pounds.
Yeah, exactly. And who wants to, once after you've gotten the treatment, you've spent the money, you've done your research, you've spent the time. You're gonna think twice about eating that cheeseburger.
Exactly.
Definitely. It's more of a psychological thing too. It's the whole experience. But so I actually weighed you before, and that's kind of part of our process here at Cosmetic Healthcare Group. We weigh the patients prior so we can mark your progress, and take before pictures, which is great, so you can see it. So what are your plans for the rest of the day after this?
I actually might go to the gym.
Great.
Later tonight, but I'm just gonna
That's awesome. And you mentioned you were on your lunch break, which is incredible.
Yeah.
This is a lunch break SculpSure.
Yes, I have to go back to work.
Which is fun. I mean, and you'll be fine to go back to work, which is crazy. It's just
no one will ever know.
No, and that's the most important part. And you know, that's what we want. We want natural results, and we have so many other treatments here at CHG, and it's just like we've got. So I'll give you. We have 4 minutes left, so I'll talk your ear off about my experience. So I came to Cosmetic Healthcare Group to do my Botox, which actually Dr. Manani did it, and it is. It is incredible. I literally left work, came here, had the Botox done, put some powder, and I left, and I went back to work, and nobody even knew anything happened to me. And that's like what we want, you know? But I feel so much better. My makeup went on better, and I look better. I look more rested. So that's just what we want. We want to be able to get treatments done and not have it known to the world. We just want people to say, you look better. So you've got 3 minutes left. And how are you feeling now toward the end?
I feel great. It's pretty consistent the whole time for me.
Are you warm?
It feels cool. More cooling than warm.
Oh, that's interesting too, because some patients feel more warm than cool. So I guess it really depends on the patient, and just, you know, I really think it depends on the atmosphere too. We have a really soothing environment, so it's just like it helps. All of it is experience. So we've got a little bit more time left. Any other questions that you have about anything? I know I'm putting you on the spot. Some patients come with a list of questions, and we love that. Like, we want you to just ask everything that we want to educate you. So anything that you have, any questions you have about anything, just feel free to come with a list. We'll talk about it. Even if it's stuff we don't have, we want to help you. So, oh, you know what else is really going to be good for you? We have SkinCeuticals. It's a body skin tightening serum, and a lot of the patients that we treat with SculpSure, we offer that serum to just enhance the treatment and enhance the effects of it.
Okay.
So it'll tighten your skin. So that'll accelerate the process. So that will be the superficial tightening. When we know that internally, deep inside, you got something going. So, 2-step process, but. So.
Should I exfoliate too? Do you think that helps? Like exfoliating your skin, like to prevent cellulite, maybe?
You know what?
I
think exfoliating your body, doing like a sugar scrub or anything like that, will only help your skin texture in general. And it's going to help remove those dead skin cells to let the serum really penetrate your pores. So absolutely, exfoliate your area, exfoliate the stomach, and then apply the serum at night and in the morning.
Okay.
And that's going to really help it seep in, which is great. We want that. We're gonna note your progress. I'm gonna follow up with you tomorrow and see how you're feeling. Also, if anybody wants, anybody that's viewing now, we have a Snapchat. It's Cosmetic HG on Snapchat, and you can follow us and watch all of our fun pictures, our videos. Dr. Manani today had his SculpSure treatment as well, so you can watch how he did. He did fantastically the whole time, 1.4. I mean, it's just really, really great treatment. And feel free to comment below, ask questions. We're here to help. We're here to educate. So yeah, I mean, everybody is welcome. We have tons of different options here. Ariana and I are going to talk about after this Hybella. We're going to talk about Botox, fillers. We just got so much to offer. So it's a one-stop shop here.
love it.
Yeah, and we're going to talk about the SkinCeuticals too. We've got so many fun products. So I'm just going to take the viewers over here to check out the screen. So as you see, we've got 11 seconds left. It's still at 1.4 the whole duration of the treatment. And then once the treatment ends, it's going to say confirm end. Yep, and here we are. Great, so your treatment is ended. How do you feel?
I feel awesome.
Great.
I'm ready to go back into the world.
Okay, wonderful. All right, anybody have any questions, comment below. Message us right on our wall, like our page. We're here to help. So we'll see you soon. Bye.